So appendicitis, or also known as acute appendicitis, is one of the conditions that we see very regularly at GNL surgical. Acute appendicitis simply is the infection of the appendix. As we all know, the appendix lies at the junction between the small intestine and the large intestine. It hangs on the right side of the tummy, and usually appendicitis pain comes from the right side, the lower side of the abdomen. Sometimes you can have discomfort at the center of the tummy and a little bit of bloatedness, but in general, most of the time, especially in advanced appendicitis, you can have pain on the right side, lower side of the abdominal wall, together with fever. There may or may not be other things like bloatedness and diarrhea. Appendicitis is always treated with antibiotics, and most of the time the advice from the surgeons will be to remove the appendix. There are two reasons for it. Firstly, with antibiotics alone, the appendicitis may get worse and may rupture. There are times when antibiotics alone can cause the appendicitis to get better. However, because the appendix has been diseased with previous infection, the likelihood of appendicitis coming back over and over again with discomfort and fever is always there. The rate at which appendicitis occurs is usually quite high in the younger generation and in the, i.e. in the children's category, and in the late 20s to early 30s category. Be that as it may, anybody of all ages can have acute appendicitis. Worst case scenario for appendicitis is that it gets more and more infected with fluid around the appendix that's causing an abscess or collection of pus, and eventually the appendicitis can rupture or burst. This would be a surgical emergency. Traditional surgery for appendicitis would be the open surgery, where you make a small cut at the right lower area of the tummy to remove the appendix and clean the inside of the abdominal cavity of the infection. Nowadays, at GNL Surgical, we mainly use keyhole surgery or laparoscopic surgery to remove the appendix with 3 small wounds in the abdominal wall that's between 0.5 centimeter to 1 centimeter to go in, wash the abdominal cavity, and remove the appendix. This appendix is eventually sent to the pathologist to examine to ensure that it is appendicitis and nothing else. Recovery from appendix surgery usually occurs anywhere from 24 to 72 hours, and you'll be discharged from the hospital. You should be able to move around and do your daily activities thereafter. With open surgery, the stay in hospital might be slightly longer. Eventually, full recovery from the operation usually occurs within 4 to 6 weeks.